Please come forward to save a seriously ill patient. She needs blood immediately. Her blood group is AB positive.
This is an urgent plea for blood. A patient in critical condition needs blood immediately. His group is B negative.
I, Dr. Akhil Vishwas, would like to present in brief about this patient, especially concerning his necessity of blood and blood product transfusion. This patient came to us 3 months back and we diagnosed him as a case of acute promyelocytic leukemia. He attended to us about 3 months back and he was so much complicated that he was not fit for getting the specific treatment, that means chemotherapy, without blood and blood product transfusion. And by this time, we transfused him with about 90 to 100 bags of blood and blood products, and then he was fit for getting chemotherapy. Now we are treating him with chemotherapy, and during his chemotherapy, he also needs some blood and blood products.
This patient is suffering from thalassemia. Thalassemia is a congenital hemolytic disorder. In this disease, the RBC become fragile rapidly, and rapidly patient develop anemia. And to save the life of this type of patients, he or she needs the immediate blood transfusion, and blood transfusion may need in every month. And if we fail to transfuse blood, then patient's life may be endangered.
Patient is admitted in Dhaka Medical College Hospital with the complaints of 9-month pregnancy with labor pain. She is now going on labor. We start to put on drip. If normal delivery is not possible, cesarean section is needed. In both cases, in normal delivery and cesarean section, we need blood transfusion.
This young man got admitted in our unit with multiple trauma in lower limb, face and head from a road traffic accident. Due to fracture of femur, he had severe hemorrhage, and to save his life, we started immediate blood transfusion. And I think his life is saved due to blood transfusion in the right moment. But in future, he needs more transfusion, and otherwise his life will be in danger.
I'm going to talk about Abul Kalam Azad, who is 12 years old and is a diagnosed case of juvenile chronic myeloid leukemia. We have started his treatment, and at this state of treatment, he has developed anemia and bleeding from multiple sides of his body, nose and gum. Now, his specific treatment is transfusion with blood and platelet, but unfortunately we have not been able to treat him by transfusion of blood and platelet because the patient's attendants cannot make arrangement for blood and platelet.
This patient came to this hospital, Bangabandhu Sheikh Mujib Medical University, with the complaints of pallor, weakness and bleeding from multiple sides, and she was diagnosed as a case of acute myeloid leukemia, which is a dangerous variety of blood cancer, after doing different investigations. And she has already given almost 30 bags of blood. During her course of treatment, she may need blood and components in any time. And if it is not available in due time, her life may be endangered.
Patient Miss Shathi, 28 years old, suffering from chronic kidney disease with end-stage renal failure, now on maintenance hemodialysis last 10 years, and patient need repeated blood transfusion at least 2 or 3 times per month to make hemoglobin more than 11 or 12 gram %, because chronic kidney disease is one of the important component and cause for renal anemia, and for correction of anemia need regular blood transfusion.
Blood is vital for life. The only alternative to blood is another's blood. Will these desperate pleas remain unheard? Just a little awareness can save these lives. The promise of a new life depends on blood. Only blood is not enough. They need safe blood. How can we ensure safe blood for them? The solution is screened blood collected from voluntary donors. The yearly requirement for blood in Bangladesh is almost 400,000 units. Only about 115,000 units are collected from voluntary donors. The remaining units are collected from friends and relatives of the patients and professional blood sellers.
আমি নিশার কারণে রক্ত বিক্রি করি, নিশার কারণে রক্ত বিক্রি করি, মা বাপ ছাড়া থাকি, আজকে 4 বছর ধরে রাস্তা থাকি। নিশা না করতে পারলে ব্লাড ব্যাংকে যাই, এই পর্যন্ত আমি 28 ব্যাগ রক্ত বেচছি, 28 ব্যাগ রক্ত বেচছি নিশার কারণে। নিশা পাই না, তার সেজন্য বেচছি রক্ত।
15-16 বছর ধরে নিশা করতেছি, এটা তো মনে করেন এরপরে আছে যে রক্ত বেরবেন, আমরা যে ব্লাডে যাই যে আমরা তো মনে করেন ওই নিশার জন্য যে 65 টাকা দেয়, আমরা ব্লাডটা দিয়ে 65 টাকা নিয়ে আসি নিশা, ওই টাকাটা রক্তটা বেচে আমরা লগে লগে নিশা খাইতে চলে যাই। আমরা তো বুঝি না এটা দোষী না নির্দোষী, এরা নেয় আমরা দেই।
আমার মা নাই বাপ নাই, আমি নিশা করছি, কই কাম কাজ দেয় না স্যার, হিরোইন দেখা কই কাম কাজ দেয় না। আজকে এই হিরোইনের লেগা রক্ত দিই স্যার, বেজবেলের লেগা জায়গা হিরোইনের বেড়া ধরলেই আর সহ্য করতে পারি না স্যার। যেই রক্তে বেশি 1 ব্যাগ 2 ব্যাগ যে তুমি যা কোলায় তাই দিই। আমাদের রক্ত লওয়া উচিত না স্যার, আমাদের রক্ত ভালো না খারাপ এটা কইতেও পারবো না। তোমার আমাদের রক্ত যদি ভালো মানুষের চলে যায় সে একটা না ক্ষতিও হবেই।
Blood infected with deadly diseases from professional blood sellers often brings people closer to death. Thus, there are constant pleas for safe blood. We need safe blood to save lives. But what exactly is safe blood?
While we are treating patients, some of our patients may need blood transfusion because of the deficiency or accident or some diseases like accident, delivery, surgery, cancer treatment, dengue, etc. But when we transfuse blood, we must remember this blood must be safe and free of communicable diseases, and it must be fully cross-matched. According to WHO and International Society of Blood Transfusion, a safe blood is one